Fellow Ghanaians, good evening. It is a privilege for me once again to come into your homes to speak to you about the state of our common battle against the pandemic of the coronavirus that is affecting all parts of the world, including our own. Exactly a week ago, I announced the lifting of restrictions on movement of persons resident in Accra, Kumasi, Tema, and Kaswa. I did so on the basis of the data and science, as well as on a careful analysis of the impact of the restrictions on several sectors of our population, especially our informal workers, who need to have a day out in order to provide for themselves and their families, the poor and the vulnerable. Since I last spoke to you, we have completed the analysis of another 32,031 samples, bringing the number of tests from 68,591 to 100,622. From this pool, the total number of confirmed infections has gone up from 1,042 to 1,550. Our recoveries are now 155 and deaths 11. The 2 new cases of death, like the other 9, are all of persons with underlying health issues, what the doctors call comorbidity. The positivity rate, i.e. the rate of infection from those sampled, continues to remain constant at 1.5%. 6 persons are critically ill, and the remaining 1,378 have mild or no symptoms at all and are responding to treatment. Of the 508 new confirmed cases, 465 are from the Greater Accra metropolitan area, 10 from Kaswa and the Central region, 7 from the Ashanti region, 6 in the Eastern region, 2 in the Northern region, 1 in Western North, and 17 from the Oti region. These 17 were the result of interceptions near Nkrumah by officers of the Immigration Service and other security personnel of 2 cargo vehicles that had on board a total of 67 passengers who were illegally entering the region from Accra during the period of the lockdown, and all of whom were tested, with 17 proving positive. We are still very much in uncharted territory, and clearly we still have some way to go towards ridding ourselves of the virus. The truth is that this will be a long war, broken up into several battles. Indeed, we registered a modest success in the important battle to trace and test many of the persons who had come into contact with infected persons, and we cannot and will not rest on our laurels. We will not let our guard down as the fight against this virus has to progress. We will pursue vigorously our strategy of enhanced 3 T's, i.e. tracing and testing to allow us to identify infected persons and isolating and treating them. It is the surest way to root out the virus. Our efforts will remain constant, as will our abiding faith in the Almighty and our determination to defeat the virus. We must continue to be grateful to members of the media, members of our security forces, and our health workers for their sacrifice and high sense of patriotism in their contribution to the fight against the virus. The health workers who are working day and night to care for the stricken must continually be in our prayers. Their efforts will be in vain if we at home do not support them. In addition to the incentive package given to all health workers, government has enabled domestic production and supply of protective equipment to our health workers to increase significantly. They have received in recent days 905,031 nose masks, 31,630 medical scrubs, 31,472 gowns, 46,870 head covers, and 83,595 face masks. We're also grateful for yesterday's gift of medical supplies from the government of the United States of America to help boost our testing capacity. The latest assistance we have received from a friendly foreign nation. So let us, on our part, continue to protect further our health workers by practicing social distancing, washing our hands with soap under running water, refraining from shaking hands, and yes, wearing our masks whenever we leave our homes. I'm happy to note that the hard-working Minister for Health, the Honorable Kwaku Agyeman-Manu, Member of Parliament for Doma Central, has, as of yesterday, the 25th of April 2020, issued directives to guide the production and mandatory wearing of face masks. We should all familiarize ourselves with them and apply them as the regional coordinating councils of the Greater Accra, Ashanti, and Central regions are demanding of their residents. Together, all these protocols will prove effective in helping each one of us to avoid contracting the virus. The doctors and scientists tell us that the virus is transmitted from human contact, talking, singing, coughing, sneezing, and thereby sending droplets of the virus from one person to another. That is why each one of us must strictly adhere to these directives. Fellow Ghanaians, in the course of this past week, I engaged a number of stakeholders to discuss the future of existing measures which have imposed restrictions on public gatherings, shut down our schools, and closed our borders. I met with the chairperson and members of the Council of State, the president and members of the Standing Committee of the National House of Chiefs, representatives of organized labor, that is the leadership of the Trades Union Congress, the leadership of the Christian community, the leadership of the Muslim community, the president and executive committee of the Ghana Medical Association, representatives and leaders of the media, and the leadership of the National Union of Ghana Students, NUCS, and its affiliated associations. The strong consensus that emerged from these and other consultations is that the existing measures must be maintained for now until we have a firm grip on the movement of the virus. This consensus is supported by data and science, and I'm also very much of this view. I have accordingly, by executive instrument, extended for another 2 weeks the suspension of all public and social gatherings, as set out in Executive Instrument number 64 of 15th March 2020, effective tomorrow, 1 a.m., Monday, the 27th of April. I'm encouraged that so many of our trotros, taxis, and buses are operating with a minimal number of passengers, and our businesses and supermarkets are enforcing the need for social distancing, the use of hand sanitizers, and the wearing of masks for all patrons and staff. I want to single out supermarkets such as Melcom, Palace, and ShopRite in particular for the excellent discipline they are maintaining in their enterprises across the country, and call upon all other enterprises, especially our market women, to emulate them. The example of markets in the Sekondi Takoradi metropolis, where social distancing is being well observed, is an excellent one for market women all over the country. I am fully aware of the sacrifices in reduced revenues that all businesses and enterprises are suffering. But I believe we have no option but to sacrifice to defeat this virus. This is the time for sacrifice so that we do not have to bear a greater cost in the future. Unhappily, there continues to be the worrying news of a few Ghanaians aiding some West African nationals to enter our country illegally, despite the closure of our borders. Even more disturbing is the fact that several of the West Africans who have been arrested have later tested positive for the virus. These are unpatriotic acts and must stop. We cannot allow a few persons who are motivated by their own selfish money-making interests to endanger the lives of the rest of the population. Not only will persons who enter our country illegally be strictly dealt with, but so will Ghanaians who facilitate their entry. As I have said before, being a Ghanaian must mean that we look out for each other. Just as the virus has disrupted our daily lives, it has also exposed the deficiencies of our healthcare system because of years of underinvestment and neglect. Whilst maternal, newborn, adolescent health and nutrition remain our top priorities, we must pay increased attention to chronic non-communicable diseases such as heart diseases, diabetes, and asthma, which have proved to be the common risk factors for the 11 deaths we have recorded from the virus. It has highlighted the need to address mental health issues in the crucial role of emergency services to which the new fleet of ambulances and drones are responding. We must emphasize preventive and promotive aspects of health in addition to care for the sick. The virus has also revealed the unequal distribution of health facilities, as we have tended to focus our infrastructure on Accra and one or two of our other big cities. But as we've seen, epidemics and pandemics, when they emerge, can spread to any part of our country. There are 88 districts in our country without district hospitals. We have 6 new regions without regional hospitals. We do not have infectious disease control centers dotted across the country. And we do not have enough testing and isolation centers for diseases like Covid-19. We must do something urgently about this. That is why government has decided to undertake a major investment in our healthcare infrastructure, the largest in our history. We will this year begin constructing 88 hospitals in the districts without hospitals. It will mean 10 in Ashanti, 9 in Volta, 9 in Central, 8 in Eastern, 7 in Greater Accra, 7 in Upper East, 5 in Northern, 5 in Oti, 5 in Upper West, 5 in Bono, 4 in Western North, 4 in Western, 3 in Ahafo, 3 in Savannah, 2 in Bono East, and 2 in Northeast regions. Each of them will be a quality, standard design 100-bed hospital with accommodation for doctors, nurses, and other health workers. And the intention is to complete them within a year. We have also put in place plans for the construction of 6 new regional hospitals in the 6 new regions, and the rehabilitation of Efiankwanta Hospital in Sekondi, which is a regional hospital in the Western region. We're going to beef up our existing laboratories and establish new ones across every region for testing. We will establish 3 infectious disease control centers for each of the zones of our country, that is the coastal, middle belt, and northern, with the overall objective of setting up a Ghana Center for Disease Control. The recent tragic CSM outbreak, with over 40 deaths, has reaffirmed the need for ready access to such infectious disease control centers, even though in our time, nobody should die of the disease. Early reporting is what is required, and I implore everybody to heed this call. We shall make these investments in our healthcare system not because it is going to be easy, but because it is self-evidently necessary to serve the needs of 21st century Ghana. The three development authorities, the Zongo Development Fund and Metropolitan, Municipal and District Assemblies will be tasked to place health infrastructure amongst their highest priorities in the coming years.
Well, we are back. Makacho said, "Shishane Sunkukra, Nana Yabrefo, so Makacho, you frontliners, a hot Neakundi Ecoso Elhonum." But quickly, another Ghana man paying His Excellency Nana Danko Kufado near Dim Common, among Fonchiri Muni or Montias, Debiada, President Kasevia, we subjected to, the subjected to. Namiadu, Information Minister, Wahomano Syria, Kojo Oppong Nkrumah, Bakumi Numi and Sebin Tempa, one Fanchi Mumre, Nafi Intimi Nkwen. Kojo Marchi, Apom to say.
People are displacing police.
Hello, Kojo Marchi, Apom to say.
Kabra Mejoso, let us say.
Namiadu Megusuka Krakra, Anna Ye Mamumu, any Juma, Monsomo Ye, a bread, Tissemu, Chesa COVID-19 Brimo. Quickly, Ene Ghana Mampenya Kasabebia, Eye Hoye Abakakra. Yebeka the good sides, but maybe there is a lot of suspicion and concern. The word that he gave us that a hospital within a year. First question is that hospital type of being and ABC. The second question is that promise of a year now should be US hospitals no the same home. And the third question is that he found a free buy. Young budget 2020 the it will be the argument say but say ya nya kwan amfasa sika to tie na ntimi ahim ye be yes discussion but a kwan ben the for service hospital every now all can is it feasible na sika no free neighbor and what type of hospital
Kola me da say no mampani ne ya kasaye no or ye announcement akase miensa e di kan ne say restrictions na to say wo ho ana tabu de atoto ne ma bebre so ibna bebiedna apply de na okimienu aka ho etoso mienu any announcement I'll come once and say, Yahre Pete Takremo who say, since the district ni biki kan wana ya chiche mens ni mu ebi, Emma district ni be kan hono, ebi o watching what you be or district hospital. And we say, other places or more project near there, the friend district hospital, a buying hospital, can see what district on ebi. Intino, wapau impening for be say. Woman, any Jumabi man, a Juman saw the assurance I say, I will see 88 district hospitals. It's about to be a 100-bed facility, a residence, Kakra, a woman, 88. Ne boy is saying, Yemfensi crew bemu, model bena or more in use. Yawada besin, Yapon cabinet meeting, no mean, anopa no mean, ne fianopa, yetana Yawada, ye fear danopa. Or this Juma championing for a health minister, finance minister, chairman of infrastructure subcommittee, Showman Sano, or Power say, Omunyas had detailed analysis we see, policy direction or the among, Omunya detailed analysis we see. Now, Omumra back, na cabinet, Inshiraso Mom, Omshiraso ya, ye the Atugana phone in him say, Nibuni, Sikano, Yakofawaha, ne the Ababe, model no enuni. In Crew 88 no crampo no so offer district na him fa na wodi besi e wo district no kra na nkwa nkofa ntawantawa bia crampo amba o be yesa adwuma ni na so bi ka se eni 2020 budget no ma no kre say sika no eni 2020 budget ni saa so na sika editia free light bill ni eni 2020 budget mo sika editia nsu ni eni 2020 budget mo 1.2 billion the alleviation program in 2020 budget. Corona nakasano. Say if you say 2020 no be a crampo ehun say corona sebe ebeba me hu sika sema ba be say. Enti no ni budget but ye wa kwanya me no ba ko ye your media review am say be July any be ye. Ho no we review utumi crampo supplementary budget wo ho depending say why a major expenditure be a change your budget no. We no kra fi ho there were other financing options to say export credit facilities near there. Utumi EUSUA sɛ saa fee no ɛmbɛka wo bosia bɔ ho a anaasɛ wo borrowing ho a wotumi ɛyɛ arrangement ɛde yɛ adwuma nti biribi akora nkɔɔkyema yɛmma mpanimfoɔ no bɛyɛ saa na wɔtwe mmienu no sɛ na wɔtwe mmiɛnsa no na ɔmo nwie ɔmo adwuma no a ɔmo ɛyɛ no sɛ na wɔtwe mmiɛnsa no sɛ yɛ na wɔtwe nan yɛ mmienu ɔmo nwie na ɔmo mbra parliament na cabinet nhyira so ma ɔmo yɛwie a afei de aban si gyinaeɛ sɛ kwan wei so no yɛde bɛfa yɛ saa hospitals district regional hospitals and Sana Centers for Infectious Disease Centers, me and Sano. Omatuni ne din na fiye ni na ya get into.
Well, Kojo, even before Sir breakdown back from Impenifa, a year Ghana man Penya power, mo this 2 weeks, a year announcement, Akasimonian Temple, Munkomra, Famra cabinet, na French, so Emma Namuntun Konkano. The fear now is that Oman Penya my timelines of a year. That's one, the major concern. Number two, the other worry is that.
Or say a fear we in fiasia. Before this year is over, in fiasia.
Okay, so point is that sir, clarification 88 in was my king. Say nay in paying for man paying power mona so cabinet shiana yajituma. A few way jumedian shas, but it's not within an AFI project. Is that the case?
Maybe and I say secondly, you fiasia analysis last week Thursday, no. Back of the envelope, as mom can say, idea Sikani already on between within a year, within 12 months on between a year. And so once I heard text of his speech, no, I say, I feel we in fear. Now, I think terminal as in 1 year from time I won't be say August to say September or so October or say July. Within about 12 months, then there was so much to me area. Until I feel once a man in Tilmuno, it go a
okay. Me perceive a TSA said the Baya DM come and say the situation and pay. So it can never be true that the promise is that within a year, 88 health facilities, ever or district, any regional capitals. That's not the case.
Omanpenin ka say a few we inconvenience and no we see 88 hospitals a year on cancer. Answer na few we be convenience no na ye fee sa project no afe and only instruction or ma say you fear say answer na afie we 2020 end. Apart from that no penny for no so chain say so mo dia so bo form na contractor kujina site a sika no wo ho a e ya dia within 12 months from commencement no one mo be to me ewie.
Okay,
you can say afie we you say na the omoka so mbetumi aye no within 12 months no omfa sa 12-month period no enwie se ko ban say August and omo fiase a na say August 2020 to be July August 2021 there also omo etumi ewie.
Okay, yati ho ase ono, but along this one also the issue of hospitals binima Ghana ye sha ase a ene na kwan ye fa so a yetu anamo e ma nitimi wie pay di mu no so no atosin ene a major consideration and attention about those hospitals. So I'm yet to make a hurry and what Mamma Corinmana.
A very legitimate question. I'm passing hospitals and as a health facilities be wha ye beto ye no then you say ye eman fie gum ema medical consumables gum and ye se boapayo ye nyusu bebre wo hwa ye beto ye no na ye wie bi o ha bon se dan no de ye si dan no si ho nso mfidie enwu ebi o ha bon se dan no ye si mfidie kakra wom but mfidie aka any de friend medical consumables so use dia ye adwuma no ebi nim enti ebi o ha bon se ye ba ni bi wa be 35% completion na 40% completion ye adwuma de aba be do bi o ha be 85 ebi o krampo ye wie penim ye wie sa facilities ni na nya dia aban be abandon and be jato was and say employ in sada say press briefing na say you be go through the whole list of outstanding facilities no baby I be to ye baby I dia be do ne kakra aka wo ho a wo say yitumi eye ewie ebi wo ho a contractor the man no eje bosia the man no wo hwe adwuma wa ye ni sika o say wa spend ya emwa no contractor for ni bi o ha ya trom be ye bosome de wo ho se ma ye begie fini nsem bi o ha abisi na me no ka say on call site Emma Attorney General any health ministry take action so mo terminate ni dia ma contractor for egu ahodo se benada no pa be go through sa details we nyina but enya dia ye be abandon no in addition to it ena de omampani e de aba as a policy instruction where ministers no ye ho adwuma na omabebu and also ye ba be the account.
Well, already you know me see kasemo ntoto no pressure ankasa in court that's so ankasa of especially when we declare this year of roads 2020. Na attention ye bia nke benya daje manage hospitals na en kakra ana we asa be and they don kuma na dia kasa ye dia bosia bo no isansi TSC highway ni so no boa na ye bo besia forgetting that Ghana will be held responsible at the end of the day. Ghana in this case referring to me no mienu nyina it yes freeze ke na ye kono enu nti na take advantage say emfa ho ne the excess pressure beba individuals so na yesi kasem to tie no ho anase de
there be said the be am no di nkomo me kasa bosia no say bosia no nsunsanso ye bosia no nsunsanso up until corona ye ba be dey no bia gitum say ye bosia na ye ka no nsunsanso no aban we ye tumi ateso no crese corona ba ya yakobo be 1 billion aba be ka ho na ye revenues akofom na ye GDP kraba bia na yesusu sa ye be kwa kodu no anhwa yentumi no ho sa already e ko oil prices ni ade no ye ka no sunsunso no be koso ka but eno ti no mampani de ahempanifo bi nsa finance minister health chairman of infrastructure subcommittee of cabinet so mo hwe ekwan a ebetumi afa so aye sa ade wi a sebi enko sei jina pa na ye jina we sikasem mum impose abre a ye hu se de akobenti ho atochema kata ye mom sa akwanya no no mu wie adwuma no mfamra so mo de ba no mo se setrens by the time ye be wie no na ye ka no nsunsun so be bi jina ni jina me gide say ye ni obi any problem
well be some sure say betimi
na ha na ba bi do a ye na behwe ni ye hu say da bi o we de ye 88 ni na awia e bi asinki nti bi anka banye no 44 next year sika no koso kakra say 44 kakaka but me say ye mom akwanya no mu wie no mu famra na fi ntino mampanika say yenye public scrutiny on the bar. Yeah, it's our public scrutiny.
Well, Brenton, so inform you quickly now for you wrap up on this conversation. It is a wiki now. We have said shared in Komo studio, but they say yes, new my educator when any anui, and share and I had said yet.
To say they and share mradetri, okay, Public Health Act 851 now, Section 171. Emma Health Minister to me. Emane issue order say yenye sadi we mfemo e hoban enti fiada no o issue order no under section 171 act 851 Ghana Health Service and the Ministry of Health ankasa di kan to statement no mampani sign esi su dia say they say sa anhye no aba ye wo no mo se wo de abri bia o mo hye titiru ye dwom o mo aduane ne nkeka ho ne ade de eno no ade a abribia o say almost ansana yemu so aye pia kwa bonten public transport so ne ade details ni nti mesre say mo so de we bono maboa ye na bibia ati ache ba sa abribia emrada ho a eye instead say nyina wo say mask no yeche
well Minister information Kojo Oppong command pay that say na o chishia bit me bi mu ye area Kojo Oppong command ne edin komo e wo kasa fidi so I'm hoping say na o chi bit me atwa komo so but stand by sister Sandy be a guy in the team no and then I was a pedio model brown a duchem cry and watch medical cultural nana ya brief in the team no so akushia frontline workers no what they go through na money be wa and they want things so they need a prayer so when you say a prayer apart from so bonfire my Ghana no obekai omo so na abetia de tia obekai omo e won bible ye call sister Sandy be a guy I crado